Since the COVID pandemic started, we are seeing an increase in our domestic violence or intimate partner violence calls, and not all of them are intimate partner. We're getting domestic related calls with family members, siblings, those sort of things. We've seen an increase. If you compare our stats to last year, we've seen roughly 10 more calls in the same time period this year than we saw last year. So again, not huge numbers, but there has been that increase compared to the same time period in 2019. The world has changed a little bit since the pandemic in terms of how we respond to all calls. When those calls are received via 911 or into our communication center, we try to do a bit of a screening or an assessment to educate our officers as to what they're going into. So asking some general questions around, is anybody sick in the home? Has anybody had travel and those sort of things? The standard questions that are going on throughout the province. And then when our officers do attend or when they arrive, they're all equipped with some personal protective equipment. We have masks, gloves, goggles that they wear. We have face shields and gowns in the more serious situations. But typically the officers are trying, we don't want to create a combative or an obstructionist approach. So we're trying to limit the use of that PPE in our first response and just keep a distance, keep a safe distance, maybe invite somebody to step out of the house and have a conversation with us. But obviously with domestic violence calls or other in progress type calls, that's not as easy to handle. And so our officers are having to don their personal protective equipment and then treat a call as they would any other call, and going into the home, separating the individuals and trying to ensure everybody's safety and then dig into the investigation. Typically, we don't see patterns in domestic violence as sort of repeat calls like we might see with, say, mental health calls or some of the others. Again, when we're going through the time of pandemic, there's a lot of stress in people's lives, whether it's financial and employment stress or, close contact and family stress, where people are trying to teach young children at home or dealing with teenagers, young adults in the home, those sort of things. And then you overlay that with just general mental health concerns for people, mental health issues that people are dealing with that, typically in the past, people have been able to distance themselves or get out for a walk or do some things, and they're not necessarily able to do that. So the anxiety and the stress within the homes is increasing, and we're seeing that not even within domestic violence, but neighborhood disputes and landlord and tenant disputes and those sort of things, where people are again, because of those stressors in their lives, the triggers seem easier to occur, particularly when they've been in isolation or a close contact with somebody for greater periods of time. The majority of our calls are what we call verbal, non-primary aggressor domestic situations. So there's, it's whether it's a husband and wife, a father and child, mother and child, whatever case, but there's lots of verbal confrontation, but no physical confrontation, thankfully. We have had a small percentage of calls involving violence that have resulted in apprehensions or arrests. But most of them are getting, when the numbers that I provided to you, typically those calls are non-violent ones. We've measured those against our assault calls from last year. So how many physical assaults have occurred, and our assaults are actually down compared to the same time period last year. But that's, again, to be expected, because not all assaults are domestic violence related assaults. Those assaults can be confrontations in the community, in liquor establishments, parties, those sort of things, which obviously aren't occurring during this time period. Again, it's quite disturbing when you start looking at somebody being in isolation in their home and how they reach out for help, and how they, everybody has the right to live violence-free and not to live in fear. That's easier said than done when, typically victims of domestic violence, they are able to connect with other people that may see injuries or may have an opportunity to share a story with somebody whether they're taking their child to school or whether they're going into work and those sort of things, which obviously aren't occurring during this time period. So, we've been trying to educate the community, and particularly those that live in those tumultuous environments, that they try and connect, even if it's virtually, with family members on a regular basis, so their loved ones or family members can see changes in their behavior or see changes in their appearances. Even though we're in this time of staying home, we really want neighbors to check on neighbors and family to support family, and it, whether it comes down to texting family when they can, and using other devices to try and connect with their family to let them know that they're in fear or that they need help. And we've really purported for many years here in South Simcoe, supporting a neighbor, helping neighbor type approach. Most of our domestic violence calls, a large number of them come from other people calling, neighbors hearing shouting and yelling, and we're really trying to encourage people to still call 911 and let us go and check on the well-being of those people. Our members deal with crisis on a pretty regular basis, whether it's on a day-to-day emergency response basis or just in dealing with people in their hardest times in life. Obviously, it's changed the world, and the anxiety around potentially coming in contact with somebody who's sick has raised a level of anxiety, I would say, within our members. More so maybe the younger, newer officers, because they haven't lived through the experiences that maybe some of the more senior ones have gone through in some previous crises or emergency response type calls. But not taking away anything, our members are used to wearing protective equipment. We always have that PPE with us for any type of call, and try and manage that level of stress and anxiety. The difficulty comes, they also the anxiety that they take home with them, because they come in contact with somebody in the work environment, and then the fear is they're transferring that into their own home environment. So we've really been trying to encourage our officers to use their PPE, to use good hand washing and safe distancing techniques, and thankfully that's occurring in our workplace, and our members have been staying healthy and supporting each other and able to go home feeling comfortable that they've done what they've had to do during that shift by wearing the right equipment. Whether they were in the time of a pandemic or whether just in non-pandemic times, there's lots of resources out there in our community, and whether you feel comfortable calling the police because you don't want your fear of the outcome of that, or whether you reach out to groups like, we have regional domestic assault treatment centers that, have toll-free crisis numbers, or, groups such as Simcoe County Local Immigration Partnership Council has a contact line for new immigrants that may be not understanding what the laws are in this country compared to where they came from, or the Simcoe Muskoka Family Connections. Having lots of resources and New Path family counseling services. We really encourage people, if they're feeling those stresses in their lives or feeling any mental anguish, reach out to some of those counseling services. They're the experts in the fields. They can maybe help rebuild something that needs to be rebuilt, or help somebody get through a time that they're struggling with. These are very different times that we're living through, and we all need those supports, whether they're mental health supports or counseling services. They're there for us in the community. We have an incredible 211 service that I think is being underutilized in our community, and people just call 211, ask for some help, ask for some guidance, get connected, and look after each other. That's again, neighbors helping neighbors, families supporting families. Just take care of each other during this difficult time.